is Rachel DeVore. I am currently a nursing student at Bryan Strand College in Parma, Ohio. Today, I wanted to talk to you all about a topic that will be very important to me in my future career field of nursing: mandatory overtime. Mandatory overtime is when an employer forces an employee, such as a nurse, to work more than the 40-hour work week. Now, many people join nursing and they're excited for the 12-hour shifts and 3 days a week. That means you have 4 days a week off to enjoy your personal life. However, this isn't always the case. Especially today, due to COVID-19, many nurses are being forced to work more than the required hours. This can be detrimental to not only the nurse, it can also have a profound effect on the patient as well as the healthcare system as a whole. For the nurse, she shows up to work, she usually has a smile on her face at the beginning of the week and does her job precisely and accurately. Now, a nurse that is tired and overworked can be very scary. To start off, they might make little mistakes or errors every here and there. Medications get misgiven, IVs get misdosed, signs and symptoms don't get recognized. This can lead the nurse to possibly losing her nursing license as well as really harming the patient. Most of the time, nurses are not allowed to refuse to work mandatory overtime. They can legally get in trouble for patient neglect, even if the nurse thinks she would just be a harm to herself or the patient. Forcing a nurse to work mandatory overtime could make a nurse become a patient herself or himself. Next, I wanted to talk about the effect that mandatory overtime has on the patient. First of all, they are not getting the patient first safety quality of care. Their health is at risk and mistakes can get made. I found an article that was written and it said that the patients have died from pneumonia signs and symptoms that if the nurses would have realized that these patients had these signs and symptoms, would they still be alive? Would they have not passed away if the nurse was more awake and alert? Long nursing hours resulted in significantly higher death rates of patients from pneumonia, acute myocardial infarctions, and abdominal aortic aneurysms. And I did get that from Potential Dangers of Nursing Overtime in Critical Care, which is in the Canadian Journal of Nursing Leadership. This shows the effects that nursing can have on the patient's safety. Next, I wanted to talk about mandatory overtime affecting the healthcare system as a whole. In the healthcare system, there is a chain of command. The patient usually reports to the nursing assistant, who reports to the nurse, who reports to the doctors. Now, if a nurse is working overtime, she's stressed, she is sleepy, she's not focused. A nursing assistant could tell a sign or symptom to the nurse and she could brush it off simply because she just doesn't have time and she can't focus, or she could overanalyze what the nursing assistant said and pass that off into report onto the doctor, which the doctor is at the heart and center of the patient treatment plan. So if an overworked nurse is giving a report to a doctor on things she may not be 100% sure of or correct on, it could be very detrimental for the patient. This is how medical errors happen: overworked and overused nurses. I believe hospitals, instead of requiring mandatory overtime, should provide safe working conditions for their nurses in which they pay well, they have good staff to patient ratios, and they provide adequate staffing in general. No nurse should be forced to watch over a patient's life when she can't even watch over her own. The nurse could literally become a patient themselves. Therefore, I believe that mandatory overtime should be completely banned from the nursing field. Thank you for your time. Have a great day.